Thank you. A very good evening. I, Dr. Nilesh Balkawade, Clinical Head, Oasis Fertility, welcome you to yet another FB Live session, which is a very important topic. And this month, we are presenting expert advices on different topics. So, today's expert advice is going to be on menstrual disorders and infertility. Friends, we all know that menstrual cycle is an important part of the woman's gynecological life. It has got two components. One is ovarian cycle and another is the uterine cycle. So any changes or problems with the ovary or any problems or changes in the uterus can cause difficulties or problems with the menstrual cycle. So we have to channelize and we have to think what is the basic problem, and therefore let's see what are the menstrual disorders or problems which are going to lead to infertility. Friends, once we consider a normal menstrual cycle, the duration of a normal menstrual cycle is somewhere between 3 to 7 days. Anything less than 3 days or more than 7 days is considered as abnormal. The menstrual blood loss, normal blood loss is considered up to 50 ml, and if it is more than that, then that is going to have some problems. Friends, uh, you have different menstrual problems which are coming up, and these are going to cause some problems. So polymenorrhagia or increased frequency of menstruation can occur when the ovarian reserve is low. So patients of low ovarian reserve can have problems of polymenorrhagia. The cycles can come a little bit earlier, and here it helps us to diagnose that the difficulty is at the ovarian level. Oligomenorrhea or increased frequency of menstrual cycle, the menstrual cycle is getting postponed, can be a symptom of polycystic ovarian syndrome or polycystic ovarian disease. So this can be one problem. Amenorrhea or no menses at all can be a problem at the ovarian level, or it can be a problem of the uterus where the endometrium is fired and the endometrium is not growing well, and therefore this can also have problems like Asherman syndrome and so on. Metrorrhagia or intermenstrual bleeding can be a problem with endometrial polyp or any cervical lesions which are there. So these are the problems which are going to cause infertility as well. Menorrhagia or increased blood flow during menses, increased passage of clots is a symptom of fibroids in the uterus, it is a swelling in the uterus, or adenomyosis, which is again a swelling in the uterus. Dysmenorrhea or intense menstrual pain or cramps during menses can be seen in patients of endometriosis and adenomyosis. Friends, this variety of problems are related to the menstrual disorders, and each of these problems can cause infertility. Poor ovarian reserve patients need immediate treatment. They have polymenorrhea, and this can be diagnosed, and they need immediate treatment. Their AMH levels and antral follicle count needs to be checked, and accordingly, the treatment can be given. PCOS patient needs lifestyle modification as a major treatment. Then they have ovulation induction, and after ovulation induction, we have IUI and IVF along with laparoscopic ovarian drilling as other options of treatment of PCOS patient. Polyp or cervical lesions, they need to be removed by removed physically, or they can be removed by endoscopic approach, that is hysteroscopy or laparoscopy. Fibroids or adenomyosis again needs to be removed by laparoscopy, so that the fibroids which are causing problems in infertility. They're all though not all fibroids will cause problems in infertility. Some fibroids will cause problems in infertility. Therefore, only those needs to be removed. Adenomyosis or swelling in the uterus can be treated surgically, can be treated medically. Some injections can be used, and so on. Endometriosis is an important disease where ectopic implants of endometrium are there, and this can be diagnosed by ultrasound and treated by either laparoscopy is the gold standard, and along with that, with or without any other medications. So, friends, menstrual disorders can cause variety of problems, and it can also lead to infertility. This was just an overview of that. If you have any problems related to your menstrual, there are any difficulties, then please connect to us and ask us whether this is causing infertility issues in you. So I don't want to extend this session much. This was just an overview of what lies deep inside. So this is just a tip of the iceberg. These problems we have to just go and dig out and find the cause of infertility in you. So thank you so much for your patient hearing, and we'll be right back with another session of ours. Thank you so much.